Childhood cancers have become highly treatable, even in refractory cases. Exciting research is underway, though. In the United States, about 70% of children with cancer are cured. But in developed nations, over 85% of children die from cancer. We have many challenges to overcome before bringing cell therapies to Africa and nations lacking adequate healthcare resources. To explore this issue, please join me in welcoming Father Kevin FitzGerald, the David Lauler Chair for Catholic Healthcare Ethics at Georgetown University. Father Kevin.
Thank you. Buongiorno. Okay, now that we've gotten all my Italian out of the way, we can get down to the talk. What I would like to do is begin by thanking the organizers and the sponsors of this great event for the opportunity to present this morning a global perspective on the treatment of children with cancer. I will not use any slides this morning, as my presentation is not focused on the science and technology of cancer treatment, but instead is focused on us. Those of us gathered here in this room and the rest of us around the globe. I include all of us members of the human community because I will maintain this morning that it will require all of us around the globe to adequately address the challenge of pediatric cancer, as well as the challenges in healthcare we all face together. As we have already heard and will hear in much more detail over the next few days, there has been an enormous advance in the development of treatments for childhood cancer. And there is tremendous promise for an even more amazing advance in the next several years. With the rapid development of biotechnology in the areas of genetic sequencing and editing, epigenetics, and immune and other targeted therapies, one can easily argue that the future for pediatric oncology and many other medical specialties has never looked better. In fact, this optimism is built on a foundation of success that has been building over the past several decades. For example, in the United States, 30 years ago, the 5-year survival rate for children with cancer was 63%. Now, the survival rate is over 83%. Wonderful progress indeed, but not progress that has been seen worldwide. Each year, more than 150,000 children are diagnosed with cancer. And importantly, that number does not capture the many children who never receive a diagnosis or treatment for their disease. As I just cited in the United States statistics, with access to quality care and treatment, more than 80% of children with cancer survive, living long and healthy lives. However, many children in low-income and middle-income countries do not receive or complete adequate treatment. And as a result, over 90% of childhood cancer deaths occur in these countries. For example, recent research in India indicates that more than 50 children from the ages of 1 month to 14 years die of cancer every day, resulting in an annual mortality rate from pediatric cancer alone of over 40,000 per year. Having had the opportunity to visit India and see firsthand the full range of biotechnology they have available in their country, the cause of this tragic number of deaths is not due to a lack of medical sophistication anywhere in India. Having also had the opportunity to work in the inner cities and Native American reservations of the United States, I can state from experience that the problem of tragic disparities in healthcare access and treatment is not limited to emerging nations such as India. Hence, the need for us all around the globe to come together to address this challenge of bringing adequate cancer treatment and care to our children. Interestingly, and perhaps uniquely in human history, this issue today of healthcare disparities is not just an issue of social justice. The issue of healthcare disparities is certainly not new, but what may be new is how the advance of biotechnology itself may also be driving us to work together to improve our ability to combat pediatric cancer, as well as many other diseases and healthcare issues. We are now in the age of personalized healthcare and precision medicine, where we will be combining our advances in genetics and genomics, in bioinformatics, and in clinical interventions to more accurately and precisely attack the causes of disease while limiting harm to the healthy tissues of the body and even promoting and speeding the healing process. This approach requires the full range of information from a broad spectrum of individuals living in a wide range of environments. We need information and experience from around the globe to fully understand the nature of health, illness, and our human condition. Prompted by this move toward personalized and precision healthcare, we can now work to design research and develop treatments in a way that will foster interactions among different cultures and peoples, not merely bring technologies to those who do not have them, but ultimately to learn from each other the unique human experiences and biology that each human group can bring to an international dialogue around how to best combat pediatric cancer and all other diseases that reduce human fulfillment for individuals and communities. Though this approach may require efforts that have not been a high priority in the past, there is much evidence to support pursuing this tact to change our research and regulatory tactics. Recent engagement of various patient advocacy groups in research protocol design and treatment development has resulted in improved effectiveness and speed in the drug development process in the United States. If engaging the patients and families at the beginning of the research and development process can greatly benefit treatment developments in the United States, why not extend this approach to the entire world? How much more might we learn at the outset of our global research programs if we engage the communities around the world where we desire to do our research? Not only will we better understand how the people we hope to bring into our research programs perceive their own disease and its effect on their lives, but we may also discover new ways to approach treating that disease, or even new genetic differences that allow some members of those communities to resist that disease by biological mechanisms we have not yet even imagined. In addition, we may also learn more effective procedures to protect research participants from any medical and social harms, procedures that are familiar to them, but new and surprising to us. Finally, by engaging communities around the world, we also increase the chances that together we can find new and improved ways to overcome political, economic, and cultural hurdles to providing treatments to any and all those who need them once they have been developed. And even if, tragically, the research we do with these communities around the world does not result in a cure for a particular disease, we still will have accomplished a remarkable and wonderful achievement. We will have made new friends and colleagues with whom we can share our commitment to bring improved care to patients in all our communities, especially our children, who are our future. Hence, even if establishing this expanded global public engagement in all our research and treatment programs strains our resources in terms of funding, expertise, and time, the return on our investment, yes, that's true, the Jesuit priest at a Vatican meeting just mentioned ROI. The return on our investment will be dramatically increased both within the targeted area of the disease treatment and within healthcare in general. Now, some of you here may respond that you have already experienced significant frustration in trying to engage different communities and cultures around the world. Considering the frustrations we all experience dealing with different groups and perspectives, even within our own countries, I think we should not be surprised by such struggles. To this challenge, I have two recommendations. Be patient and partner with organizations who have some experience in global interactions. As we all know so well, bridging personal and ideological divides requires perseverance and patience. However, also, as I hope we all know well, it is worth the effort when one is able to bridge those gaps, since one is enriched both by the new friendship and by the increased awareness of how one should go about addressing obstacles to developing new collaborations. In other words, practice makes perfect. Secondly, rather than reinventing this wheel, you can lean on collaborators you already have to gain some insight into how best to engage different communities from around the world. One such collaborator is the organization that runs this smallest country in the world, wherein we are holding this meeting. Though tiny in acreage, the Catholic Church runs, I believe, the largest healthcare system in the world, and is present in many countries and communities across the globe. Now, while I certainly cannot speak for the Vatican, or the Society of Jesus, or even any department or center at Georgetown University, I believe that the fact that Cardinal Ravasi and the Pontifical Council for Culture have already shown a great commitment to this effort to bring better health care to the world through engaging the biomedical research and development community, you may not be disappointed in working with the Pontifical Council for Culture and other entities of the Catholic Church to help you more smoothly connect and engage the communities you wish to work with around the globe. So as we go forward with our conference, let us together deepen our commitment and our collaboration to move the 90% of the children who die of cancer in the poor areas of our world into the category of the almost 90% who survive their pediatric cancers to live a full and long life. But also, even for those we cannot save with our cutting-edge technology and treatment, let us continue to help them experience that we can and always will care for them until the end of their too brief but still meaningful and precious lives. I thank you for your time and attention, and most of all for your caring for the vulnerable among us. Thank you very much.